Hello, everybody. Okay. This week I have cholesteatomas. Okay, a cholesteatoma is a benign tumor, meaning it's not cancerous. It's found in the middle ear or the mastoid process. It occurs when skin from the ear canal grows into the middle ear through a hole or a tear in the tympanic membrane. It can also occur when the eustachian tube becomes blocked and creates a vacuum within the middle ear. This would cause the tympanic membrane to bend inward and form a pocket, which the cholesteatoma grows within. Old skin cells can get stuck in this pocket and develop into cysts that become cholesteatomas. It can also occur during the fetal development. This is when it's considered congenital. Skin cells get trapped within the middle ear behind the tympanic membrane. And if this does occur during the fetal development, it will most likely grow at a much quicker pace than in an adult who has acquired cholesteatoma. It also occurs from recurrent ear infections or if there are any skull or facial bone birth abnormalities. Some signs and symptoms include pus, drainage, ear pain, ear numbness, headaches, dizziness. This one's more rare, but weakness of the facial muscles, and it can cause hearing loss. This is if it affects the tympanic membrane. It can have an effect on the movement of the ossicles in the middle ear. And it can also affect the cochlea. And if this is the case, it can cause a permanent hearing loss. If it's untreated, it can erode the bone structures of the middle ear in the mastoid process, which would warrant need for reconstruction of the ossicles or a hearing aid that or like a oh my gosh, what the heck is it called? Oh, a cochlear implant, so that this individual doesn't need sound is going directly to their inner ear and they aren't using the middle ears for hearing. It can affect the vestibular labyrinth of the inner ear, which would cause the patient to have problems with their balance. And as stated before, it can affect the facial nerves. It can damage these if it grows on any of the facial nerves. It can also cause meningitis. Okay, and then statistics. It wasn't super clear on the populations that are most affected, but I did find a few different resources that said this is more common in males than females, and it's highest in the Caucasian population. There was a study conducted that the results concluded 10.4% of patients have reported positive family history of cholesteatoma, which means it could be hereditary. And these individuals are more likely to have bilateral cholesteatoma. And then occasionally it's been associated with patients who have cochlear implants. And then the site of lesion most commonly is the middle ear or the mastoid bone, but it can sometimes start in the external auditory canal. And then to diagnose, it's pretty simple. Your audiologist will conduct a case history, and then a physical exam and autoscopy. And if there is any indication of the cholesteatoma, they'll refer to an ENT to take a closer look. And then the ENT will order tests, most commonly a CT scan, and the CT scan will indicate if a cholesteatoma is present where it is, if it's present, and if it is growing or not. And then if the patient has reported any difficulty with hearing, your audiologist could perform an audiogram to test the patient's hearing status. And then treatment and management. So most often a patient will get surgery to remove the tumor. The bigger or more advanced cholesteatomas would warrant need for multiple surgeries. And it needs to be, the tumor needs to be removed completely, or it can grow back. The surgery, there are surgeries specifically that can help restore the eardrum or rebuild the ossicles if those have been affected by the cholesteatoma. And then if the cholesteatoma, if the site of lesion was the mastoid process, then a mastoidectomy can be conducted to remove sections of the mastoid bone that were damaged by the cholesteatoma. And then here's a little video.
If you have been suffering from earaches, drainage, or loss of hearing in one ear, a cholesteatoma may be to blame. A cholesteatoma is an abnormal skin growth that forms when part of the eardrum retracts into the middle ear. Infections or tears on the eardrum can result in an expanding cyst or pouch that pushes into the middle ear. As this pouch expands, it can push on the delicate middle ear bones responsible for transmitting sounds to the inner ear. People suffering with this condition experience symptoms including dizziness, hearing loss in the affected ear, facial paralysis, taste disturbance, and pain or numbness in or around the ear. Your doctor may recommend a professional examination or surgery to remove the infection and restore normal hearing. Usually, if left untreated, the cholesteatoma will continue to grow and your symptoms may persist or get worse. A cholesteatoma can be dangerous if ignored. Do not wait to ask your doctor about tests and treatments for the condition.
Okay. And here are my resources. Okay, guys, have a wonderful week.